hotline of conversations around vaccine inequality and global health. I am delighted to welcome to the virtual stage the CEO of the Serum Institute of India, Adar Poonawalla. Welcome.
Thank you. It's a pleasure to be with you here at the India Global Forum. Thank you for having me.
So, Adar, the pandemic wasn't, or should not have been, a surprise. In fact, we were prepared for it. And we even had a system in place called COVAX to help distribute vaccines in a fair way. But when the crisis came, vaccine distribution became the haves versus the have-nots. I'd love your view on what went wrong and how do we set this right?
Well, I don't think things have gone that badly wrong. If I just put things in perspective, you need billions of doses of vaccines. And as we all know, the global capacity with all vaccine manufacturers in the world put together is nowhere near enough. Of course, that's being ramped up. We're ramping up. Others are ramping up. And given that shortage, of course, there was going to be always a situation where countries would have to wait. Some of the nations which could afford it did get ahead of some other nations. But that's exactly where COVAX plays a role. And we had, in fact, started to export a lot of doses from India. We've exported 60 million doses between January and the end of February, which is perhaps more than any other country. And, then the second wave in India hit us, and we had to focus all the firepower and the vaccines to the Indian population because that was where it was needed the most. And having said that, in even your earlier conversations with others today, it's clear that eventually India will go back to supporting COVAX in a few months and start re-exporting vaccines so that there is equitable distribution, which was the original objective of COVAX.
So we know that the creation of the vaccines was a miracle of science, as is, in fact, the production that you're involved with. Do you think we did as well as we moved from invention to manufacturing and distribution?
Well, I think, this has never been done before at this speed. I mean, normally it takes at least 4 or 5 years to go from development to large-scale manufacturing because you normally set up the facilities, buy all the equipments, after your product is proven. A lot of, manufacturers started setting up the facilities at risk, including us. That's why we were able to have, in such a short period of time, such a large capacity. I mean, every few months we add an additional building with equipment, and that's how we've been able to ramp up. In January, we were at 50 million doses a month. In March, we were around 70. And now in the month of June, I'm pleased to announce that, we're at 90 million doses a month, and we'll probably add another 10% to that output in August. So, this has happened at world record speed, not just at Serum Institute, but even at other manufacturers.
How would you describe the challenge of vaccine supply today?
Well, that's a complicated question because you've got certain countries who want to vaccinate all kinds of age groups. You've got the United States, which is, vaccinating all the way down to the age of 12, which is fine because, different political regimes have different views. They feel, and everyone is responsible for their own population first. You can't blame anyone for that. Including India, going to other parts of the world, which is really where we want to be, so that there is equitable distribution. Having said that, today we're vaccinating anywhere between 4 to 5 million beneficiaries a day in India, which is incredible. I think that's the highest anywhere in the world. We have now administered more than 330 or 340 million doses to Indians. You're seeing a ramp up in a lot of other countries, so it's really going quite well. And by the end of December, I think a large part of the Indian population should be vaccinated. I don't know exactly how much. It'll all depend on the other manufacturers, how fast they can scale up and how much more we can import into our country. But globally speaking, I think is going as well as it possibly could.
It's really interesting because there's a real difference between the rich world in some ways and other parts of the world. You mentioned the United States, my home country, where of course you can understand what President Biden wants to do, right? Of course he wants to vaccinate as many people as possible, all the way down to 12. However, we know that there are still parts of the world where frontline healthcare workers and with the world's most vulnerable still aren't protected. So, of course, this isn't your decision, but how do you view these two competing issues?
No, absolutely. It is an ethical dilemma. It's also an economical issue because, economic issue, sorry, because unless these other countries and economies also open up, the international trade between India, between the US, Europe, Africa, the African continent, all that is dependent on everyone getting vaccinated. So it's not just about protecting everyone. Having said that, we were on track to doing this. It's only when you see a large amount of infection and disease in a certain area where you do need to focus vaccines to save the maximum lives and create the maximum impact. That's, the situation that we're in. So as I said, in 2 or 3 months, we almost certainly hope to get back to the original plan of, vaccinating as many people as widely as possible to balance the inequality issue that you rightly mentioned that exists sadly today.
I want to take you back to the time when you had to stop exporting. You've mentioned before that it was a really difficult time. You had promised COVAX a lot of vaccines. Vaccines were supposed to go to other parts of the world. When you needed to keep those in India, can you tell me about some of the calls that you had? What happened? What was that time like?
It was a particularly stressful time, no doubt about it, because it wasn't just, our partners, AstraZeneca, that needed vaccines for other parts of the world. It was COVAX. It was other countries that we had to, we had commitments with. We had taken advanced funding. We had to return some of that funding and really explain to other world leaders as well that there really is no choice at the moment, and we need to support our nation at the moment for a few months, and we will get back to you. And it was difficult for everyone to digest that. And slowly, once they realized and saw what was going on in India, I must admit everyone was really supportive and understanding. And come May, June, all that sort of stuff settled down, and we've reached a sort of settlement and understanding with all these organizations.
I'd wonder what your view is on the argument that India and South Africa have advanced to loosen intellectual property rights on vaccines to increase supplies. Do you think we should do that?
Well, whether you do that or not, and I know a lot of people have weighed in on this, as major manufacturers, and I can speak on behalf of other fellow vaccine manufacturers, generic vaccine manufacturers as well, waiving of IP is, I don't know, perhaps not going to solve the immediate shortage of vaccines. In the long term, to be prepared for future pandemics, I think it's a good strategy. Why not? A sharing of technology which is accessible, where you don't have to getting into deal making, and hope to partner with other manufacturers and innovators. That does save a lot of time during a pandemic. I mean, I remember doing this around about this time last year. We were struggling to get all the partnerships signed because until you have certain legal agreements, it does take time to import, viral strains and product and raw materials and buy equipment and all of that to get going. So I think for future pandemics, this could be a great platform and mechanism to save time. But I think it probably wouldn't be fair to all the innovators as well to just have a blanket waiver without any commercial terms for them. If it's just a patent that could be violated, it's not really going to help. I mean, I wish it could have, but if you look at the time taken to build a facility, to actually transfer the technology. So it's not just about the patent, it's about the innovator showing and teaching the process and transferring that to a manufacturer, which will finally result in product coming out, and that would take anywhere between 1.5 to 2 years, unless you're really already an expert in that particular technology. So we had that advantage, so we could move quickly. But if we're talking about transferring this kind of technology to other manufacturers, it's going to be challenging and time consuming.
It's also so critical how these vaccines are manufactured. It's really difficult to get the WHO to give its stamp of approval, as you know, I know, to a manufacturer. There's a lot of discussion about how we can make other countries in other parts of the world be able to manufacture those vaccines. How long will it take to make safe places like the one you have?
So, I've always talked about global harmonization for pandemics in terms of regulatory qualifications and a set quality standard that everybody can agree on. So if you look at 4 or 5 major regulators, the US FDA, UK MHRA, EMEA, the WHO, and if you put them together with the major manufacturing countries, India, China, US, UK, and whoever, I'm sure we can come to a standard which is acceptable to all. And that will really save a lot of time, both today and in future pandemics. I mean, you look at what's happening today in terms of the licensure of vaccines. The free flow of goods and vaccines is most critical. And if we have regulatory barriers as additional barriers to what we already have in terms of vaccines and prices and all of that, then it really makes it very difficult for all kinds of vaccines to be freely accessible to everybody. I mean, that would be, I assume, the ultimate objective. So even when you talk about vaccine certification, if, for example, the WHO, which has a very high standard, approves a vaccine, I hope that all the leaders can come together to reach a certain standard where they say, okay, if you're WHO approved, a vaccine certificate from your country, even though you're not selling a product in a different region, should be acceptable for the citizens who have been vaccinated using a WHO pre-qualified vaccine. I mean, it's as simple as that. So these sort of things really still need to take shape if we're talking about free movement, not only of vaccines, but also of human beings, which actually ends up being, it's your economic benefit as well. If you can't have people moving around for business and for work and other things and investments, it does jeopardize the ability to trade, to do so many things.
It sounds like you're referring to these vaccine passports as well, the controversy from the EU Medicines Agency, how it recognizes Covishield, which is AstraZeneca in Europe, and it's been that name for Indians, for those from COVAX countries. Tell me more about this controversy. How did we get here?
Well, it's not a controversy at all. Let me just say that. I think it's just been blown out of proportion. Firstly, the EMEA is absolutely correct in asking us to apply, which we have through AstraZeneca, our partners, a month ago. And that process has to take its time. An approval process, even with the UK MHRA, the WHO, it took its time, and we have applied to the EMEA. The issue of vaccine passports is slightly different. What I'm trying to say is that let's take a manufacturer outside of India, for example. Let's say they're approved by the WHO. Everyone in that country gets vaccinated taking that product. Now, when those people, those citizens need to travel, what good is their vaccine certificate if it's not acknowledged and the reciprocity is not there between countries? It's just basically like a visa now, isn't it? I mean, for example, if my country accepts your visa, your country should accept mine. So it's that level of reciprocity that we would hope and like to see between all these nations. And look, I mean, in a month, we're quite confident that the EMEA will approve Covishield. There's no reason why not to, because, it's based on the AstraZeneca data. Our product is identical to AstraZeneca, more or less, and it's been approved by WHO, the UK MHRA. So it's just a matter of time. So it's not really going to hinder anything. But the reason why it was flagged is because if we don't address it now, when India gets off the red list and when citizens want to travel, they should not be refused in a given country just because they have a Covishield certificate. So it's all happening for the positive, and it should take its place at the right time. So it's all addressed by the time, a lot of people start to travel. So I don't think there's any controversy to worry about at the moment.
Good to hear. Tell me about this issue around vaccine hoarding. There's issues in the United States, for example, comments that Biden is hoarding vaccines for a possible another wave in the U.S., for possible third vaccinations. I wonder how we stop that from happening, how we encourage the richer countries to stop doing that.
Well, I think there's a lot of public pressure, and, for me to comment on whatever a leader decides to do for their country would be unfair because I don't know their situation. But, eventually, I think everyone realizes that they need to give vaccines to the whole world. And President Biden has made that very clear. He's going to give doses to COVAX. He's going to give doses to some other countries. So I think he's made that commitment. I don't think it's a hoarding on a permanent basis. So I think we'll just wait and watch. And I think public pressure is, the only thing that one can do to, urge governments to be global in their thinking. And I think President Biden has made it very clear they're not going to keep vaccines just for the U.S. And the world is grateful for, them sharing their doses with everyone.
I wonder if you think countries are coming together more now, or if we're still seeing the kind of aggravation that we saw earlier in terms of worrying about who has the vaccines. I'd love to know what the role of Indian leadership is as well, playing this.
So, there was initially a lot of politics because of the vaccine shortage, who was responsible, and, I'm not talking about in India, I'm talking about globally, even in Europe, everyone wanted to find somebody to blame. I won't go into that because that may go off the tangent, but, after everyone realized that there was always going to be a shortage of vaccines and nobody really is to blame, and we can all be upfront about how much time it really takes to produce and deliver vaccines, especially some vaccines with certain temperature requirements and other requirements, which nobody could have planned for beyond what we did. I think now everyone, including the public at large, has realized that. And as we've seen, vaccine programs both in India, in Europe, in the UK that have been vaccinating millions of beneficiaries on a daily basis. Now I think everyone is a lot calmer, and even with these new variants, the good news is the vaccine is working against them, most of these vaccines that are licensed. So I think the panic is much lower than it was a couple of months ago.
How well do you think the world is prepared for the next pandemic? What have you learned?
Well, we've learned a lot of things. I think the world can still come together on ensuring long-term capacity. And this is what I've always said, that, okay, this pandemic may be hopefully over in 2 or 3 years, maybe 4 years. But then what are we doing about keeping and stockpiling empty capacity? And this is what we have offered to certain regions and other countries.
What does that mean, stockpiling empty capacity?
So what I mean is entering into a long-term contract for 10 or 15 years with a certain region or a country which doesn't have the ability to manufacture vaccines, giving them the priority and, at a fixed price. So, for example, imagine that you could have a 15-year idle capacity for a small reservation fee to a manufacturer who could supply an entire region on priority with the push of a button, with multiple different technologies and products that could be put in there. So, for example, in 5 years' time, there's another pandemic. Somebody innovates and makes a messenger RNA or a viral vector vaccine. Where are you going to produce it? Again, to find partners, to find capacity, then you do a tie-up, you negotiate on pricing, all of that. So instead of that, why not have that inbuilt for 15 years as a long-term contract where a lot of countries are willing to do that? I mean, today, for example, where does a country spend in my opinion, or anyone else's opinion, their national budget. You know, do they spend it buying fighter jets, arms, space programs, or do they now invest in empty capacity for the long term, which they can, with the push of a button, secure their nation against any pandemic? So this is what I'm proposing, that this is where the world community needs to come together and have 4 or 5 of these massive centers of manufacturing, probably in the countries which are already doing it, to be able to service the world going forward. And I think that would be one way of addressing the future pandemics. And again, the global harmonization for regulatory, so that a manufacturer does not have to go to multiple different countries and regulators to have a vaccine that adheres to a quality standard that everyone is willing to accept. So what I would urge the regulators to do is come to a certain quality standard, which makes life a lot easier and faster for manufacturers to then just apply and adhere to that. That would also address vaccine certificates. It would address CGMP manufacturing. It would address the clinical standards as well. So there would be one clinical standard, so you don't have different people doing different kinds of trials. And then, you know, all this criticism and politics, oh, you should have done this, you should have done that. So these are the things that I've learned from this pandemic that I would propose to the world leaders and the world regulators to come together to be better prepared for the future pandemics, so that we can act faster with none of this stuff that we've experienced in the last 1 year.
How do we do that? Who's going to organize that? The WHO has been an amazing organization. It is well known to be under-resourced. Who is going to coordinate that?
Well, you've got world leaders, you've got G7, you've got G20, you've got WHO and the UN. I'm sure between these great people and leaders and countries, they can come to some conclusion and understanding, because to be honest, this would be the most impactful as far as, you know, being prepared for future pandemics. These 2 or 3 or 4 measures that if they can agree upon, and I know it's not easy, it's not going to be easy, but you asked me a question, how do we prepare for the future pandemics? This is how you have to do it. I can't do it as a manufacturer. The industry can't do it. It'll have to be in collaboration by these countries, by the UN, the WHO, and probably these major countries that have manufacturing and the most regulation, or the main, as I said, those 4 or 5 regions which regulate the world as far as quality standards are concerned.
Can I ask you what keeps you awake at night now?
I don't know. There's always a new challenge every day. There's a new controversy. There's something new that we need to deal with. But, you know, I think just being transparent on data and what we're doing in terms of production, in terms of what we hope to do, I think that definitely helps the situation. And to be honest, what keeps me up at night is, you know, the lack of preparedness that we still would have going into future pandemics, as I mentioned. And until we have all this sort of stuff regularized, I think that we're still going to struggle to give out output at the same speed that that we all expect. Because, you know, if you just go back to have a structure in place to manage equitable distribution. And that is very important, because once you make the vaccines, you want them equitably distributed. So I think that model has proven itself to be very good and successful. And you're going to see by the end of this year the huge success that COVAX is going to have, because you're going to have so many more doses coming out of India, not just from Serum Institute, but other manufacturers also. And so, you know, we're just waiting for that time to happen. And, you know, we're just hoping that everyone can just be patient and take precautions until that day comes. So we're just waiting for that.